told. And following region of the upper limb is the arm region. Arm region is bounded superiorly by conditional line which connects pectoralis major muscle and latissimus dorsi muscle. Inferiorly, it is bounded by the line which passes above two transverse fingers placed on the epicondyles of the humerus. Main vessels and nerves of the arm region is brachial artery and four nerves which comes from the brachial plexus. We have told that five main nerves arises from the cords of the brachial plexus. These are axillary nerve, radial nerve, ulnar nerve, musculocutaneous nerve. From these nerves, only four nerves descend on the arm region, so except axillary nerve, because we have told that axillary nerve by quadriangular space passes in the deltoid region, is left in deltoid region, and its function is to innervate the deltoid muscle. So main nerves which comes down the arm region from the shoulder is radial nerve, musculocutaneous nerve, median nerve, and radial nerve. Superficial layers of the arm region is skin, subcutaneous fat tissue, superficial fascia. Below the superficial fascia is located deep fascia. Deep fascia gives off two intermuscular septa to the humerus, which with deep fascia divides the arm region into two compartments: anterior flexor compartment and posterior extensor compartment. So anterior compartment of the arm includes flexor muscles, posterior compartment of the arm includes extensor muscle. Because before we explain the compartments of the arm region, let's say which vessels are located in a superficial layer of the arm region. In superficial layers of the arm region, lateral side is located cephalic vein, medial side is located basilic vein. Cephalic vein all the way of the upper limb is located superficially, and when it leaves the arm region, it passes in deltopectoral sulcus and drains into the axillary vein. So lateral side we have cephalic vein, medial side we have basilic vein, but basilica is located superficially only in the lower third part of the arm region. In the middle third part of the arm region, it pierces the deep fascia and drains into the brachial vein. So in upper third part of the arm region, basilica is not located superficially. Lateral side cephalic vein is accompanied by cutaneous nerve, superior and inferior lateral cutaneous nerves. Superior cutaneous nerve comes from the axillary nerve, inferior lateral cutaneous nerve comes from the radial nerves. With these nerves innervates the skin of the lateral part of the arm region. Medial side, the basilica is accompanied with medial cutaneous nerve of the arm. This is that nerve, that cutaneous nerve, which comes from medial cord of the brachial plexus. So in superficial layers, lateral side on the arm region, we have cephalic vein, which is accompanied by superior and inferior lateral cutaneous nerves. Medial side, we have basilic vein, which is accompanied by medial cutaneous nerve of the arm. And also the skin of the medial side of the arm region is innervated by intercostobrachial nerve. We see on the picture this intercostobrachial nerve comes from intercostal nerves, which is located in the intercostal space. So except medial cutaneous nerve of the arm, skin of the medial side of the arm region is innervated by intercostal brachial nerve. Deeply, so below the deep fascia, we have two compartments, anterior and posterior compartment. So we have told that deep fascia gives of two intermuscular septa to the humerus, which with deep fascia divides the arm into anterior and posterior compartment. So anterior compartment boundaries will be anteriorly deep fascia, posteriorly humerus, and two intermuscular septa, medial and lateral intermuscular septa. Anterior compartment of the arm includes flexor muscles. Free flexor muscles are located in anterior compartment. These are coracobrachialis, biceps, and brachialis muscle. Coracobrachialis, biceps, and brachialis muscle. Posterior compartment of the arm includes one extensor muscle, triceps muscle. Main vessels and nerves of the arm region is brachial artery, which is continuation of the axillary artery. It's the level of the lower border of the teres major muscle. Axillary artery down continues to the brachial artery, and brachial artery is located in the anterior compartment. So all the way of the arm region, brachial artery is located in anterior compartment, medial side, which is accompanied by two brachial veins. So deep vessels of the arm region is brachial artery, which is accompanied by two brachial veins. Veins is not shown on this picture, but brachial artery is accompanied by two brachial veins. So deep vessels, we have brachial artery and two brachial veins. Brachial artery, all the way of the arm region, is located in anterior compartment, medial side. The main nerves, so deep nerves of the arm region is ulnar nerve, is musculocutaneous nerve, is median nerve, and radial nerve. Nerves are located differently in superior third part, middle third part, and lower third part of the arm region. So arm, except the compartments, is divided into three parts because these nerves are located differently in upper third part, middle third part, and lower third part of the region. Brachial artery and veins we have told. Now let's start explaining of the nerves. And first of all, muscles, what we have told, which is present in anterior compartment of the arm, we have told three muscles are located, coracobrachialis, biceps, and brachialis muscle. Coracobrachialis muscle is short muscle, which is present only in the upper third part of the arm region. In the middle third part of the arm region, we have only two muscles, biceps and the brachialis muscle. In the lower part of the arm region, in anterior compartment, also we have biceps and brachialis muscle. In superior third part of the arm region is present the coracobrachialis muscle. Let's start from the ulnar nerve. Now, ulnar nerve, origin of the ulnar nerve, it comes from medial cord of the brachial plexus in pectoral triangle of infraclavicular region. when it descends in the shoulder in subpectoral triangle, ulnar nerve lies where? Medially to the axillary artery. From shoulder, when it descends on the arm, it passes in anterior compartment of the arm region, and in superior third part of the arm, ulnar nerve is located medially to the brachial artery. Medially to the brachial artery, but in the middle third part of the arm region, it pierces the medial intermuscular septa and enters the posterior compartment of the arm and lies medially to the triceps muscle. So ulnar nerve in anterior compartment of the arm is present only in the superior third part of the arm region. From the middle third part of the arm region, it is located in posterior compartment, medially to the triceps muscle. Median nerve, origin of the median nerve is formed by roots of the median nerve. We have told that medial cord of the brachial plexus gives of medial root of the median nerve, lateral cord of the brachial plexus gives of lateral root of the median nerve. By junction of these two roots is formed the median nerve, which in subpectoral triangle of the shoulder is located anteriorly to the axillary artery. When it descends from the shoulder on the arm region, it also passes in anterior compartment of the arm. Anterior compartment of the arm, all the way of the arm region, it is located in anterior compartment, but in superior third part of the arm, it lies laterally to the brachial artery. Middle third part, it crosses anteriorly the brachial artery, and lower third part of the brachial artery, it is located medially to the artery. So median nerve in upper third part of the arm region lies laterally to the brachial artery. In the lower third part of the arm region, it is located medially to the brachial artery. Musculocutaneous nerve comes from lateral cord of the brachial plexus in pectoral triangle of infraclavicular region. In subpectoral triangle, it lies laterally to the axillary artery. From shoulder, it descends on the anterior compartment of the arm, but lies differently in upper third part, middle third part, and lower third part of the arm region. In upper third part of the arm region, musculocutaneous nerve lies through the coracobrachialis muscle. So pierces the muscle, lies through the coracobrachialis muscle. In the middle third part of the arm region, it lies between biceps and brachialis muscle. Biceps and brachialis muscle, and now biceps is cutted to show this nerve. And in lower third part of the arm region, musculocutaneous nerve is located between brachialis and tendon of the biceps muscle. And then from the lower third part of the arm, it passes into the superficial layer of the arm region. Superficial layer of the arm region changes the name and becomes the lateral cutaneous nerve of the forearm. So on the elbow and on the forearm, we have lateral cutaneous nerve of the forearm, which is continuation of the musculocutaneous nerve. That's why this nerve is called musculocutaneous nerve. On the arm region, it innervates the muscles. It is located deeply through the muscles, but on the elbow and on the forearm, it innervates the skin of the lateral part of the elbow region and lateral part of the forearm region. Fourth nerve, which is located deeply on the arm region, is the radial nerve. Radial nerve, origin of the radial nerve, it comes from posterior cord of the brachial plexus in pectoral triangle. In subpectoral triangle of the infraclavicular region of the shoulder, it lies where? Behind the axillary artery. When it descends from the shoulder on the arm region, radial nerve passes in posterior compartment of the arm, where it lies between triceps muscle and the humerus. It passes on the bone. On the humerus is located the spiral groove where is located the radial nerve closely to the humerus. So that's why when there is fractured, the humerus mostly is damaged the radial nerve. Why? Because the nerve is located on the bone in the spiral groove of the bone, and at this case, during damage of the radial nerve, is developed the wrist drop syndrome. It spirally surrounds the posterior compartment of the arm and enters in anterior compartment of the arm region in the lower third part of the arm, where it passes between biceps and brachioradialis muscle. So, radial nerve is located in posterior compartment. Function of this nerve is innervated the extensor muscle, triceps muscle on the arm region. So it is present in posterior compartment of the arm, but in the lower third part of the arm region, it lies in anterior compartment. Where it passes between biceps and brachioradialis muscle, where the nerve is divided into superficial branch and deep branches. Do we understand? Brachial artery is located in anterior compartment of the arm region, medial side of anterior compartment of the arm region. So during direct access to the brachial artery, so projection line of the brachial artery on the skin is on the medial groove of the biceps muscle. So during direct access to the artery, incision on the skin is performed on the anterior compartment at the level of the medial groove of the biceps muscle. On the elbow, we have also two regions, anterior region of the elbow and posterior region of the elbow. Superficial layers of the elbow are skin, subcutaneous dead tissue, and superficial fascia, where lateral side and medial side of the elbow we have lateral side cephalic vein, medial side we have basilic vein. Lateral side, the cephalic vein is accompanied by lateral cutaneous nerve of the forearm, which is continuation of the musculocutaneous nerve, and medial side, the basilic vein is accompanied by medial cutaneous nerve of the forearm, which comes from lateral cord of the brachial plexus. So on the elbow in superficial layers, laterally we have cephalic vein. Skin of the lateral side is innervated by lateral cutaneous nerve of the forearm. Medial side we have basilic vein and medial cutaneous nerve of the forearm, which innervates the skin of the medial side of the arm elbow region. Between cephalica and basilica is formed the anastomosis. This anastomosis may be different forms, N-shape anastomosis or maybe M-shape anastomosis. If it is N-shape anastomosis, this vein is called the median cubital vein. If it is M-shape anastomosis, lateral side, this vein is called the median cephalic vein, but medial side, it is called the median basilic vein. This is the superficial veins where is formed the intravenous injection. So on the elbow, intravenous injections is formed in median cubital vein. Deeply on the elbow, we have deep fascia, which covers in anterior region of the elbow the muscles, in posterior region of the elbow bone enlargement. So in anterior region of the elbow we have muscular enlargements, in posterior region of the elbow we have bone enlargements. Anterior region of the elbow by the muscles is formed the cubital fossa, lateral side, the fossa is formed by brachioradialis muscle. Medial side, it is formed by pronator teres muscle. And floor of the fossa is formed by brachialis muscle and tendon of the biceps muscle. Posterior region below the deep fascia, we have bone enlargement. Medial side, we have medial epicondyle. Lateral side, we have lateral epicondyle, and between them is located the olecranon process. In anterior region of the elbow, by these muscles is formed the sulcuses. We have anterior median cubital sulcus, anterior medial cubital sulcus, and anterior lateral cubital sulcus. Anterior lateral cubital sulcus is formed laterally by brachioradialis muscle and medially by the brachialis muscle. Anterior medial cubital sulcus is formed by pronator teres muscle and brachialis muscle. So pronator teres will be medial side, lateral side will be brachialis muscle and tendon of the biceps muscle. Sulcuses includes deep vessels and nerves of the region. Anterior medial cubital sulcus includes the brachial artery and median nerve. So from the lower third part of the arm region, brachial artery passes into the anterior medial cubital sulcus, where it is accompanied by median nerve. These vessels and nerve is covered by the bicipital aponeurosis. And when it's measured the pressure, the instrument must be placed on the medial side of the elbow. So because pulsation of the artery is felt in medial side of the elbow region. Anterior lateral cubital sulcus includes radial nerve, where the radial nerve is divided into superficial branch and deep branches. Superficial branch enters down the anterior compartment of the forearm. Deep branch enters the posterior compartment of the forearm region. Posterior region of the elbow, we also have sulcuses, but this sulcuses is called posterior medial cubital sulcus and posterior lateral cubital sulcus. Posterior medial cubital sulcus is formed medially by medial epicondyle, laterally by olecranon process. Posterior lateral cubital sulcus is formed laterally by lateral epicondyle and medially by olecranon process. Nerve, which is present in posterior region of the elbow, is ulnar nerve, which is located in posterior medial cubital sulcus. So we have told that arm region in the middle third part of the arm, ulnar nerve is located in posterior compartment of the arm medially to the triceps muscle. So from middle third part of the arm region, from posterior compartment, ulnar nerve descends in the posterior medial cubital sulcus of the elbow. During fracture of the bones of the elbow region, mostly damage the ulnar nerve. Why? Because ulnar nerve is located on the bone. It lies closely on the bone, where in the posterior medial cubital sulcus. Under the bicipital aponeurosis is in anterior region of the elbow in anterior medial cubital sulcus. Brachial artery is divided into radial artery and ulnar artery. Radial artery and ulnar artery, where the radial and ulnar artery gives off recurrent branches which passes upward and makes anastomosis to the collateral branches of the brachial artery. So brachial artery on the arm region gives off the collateral branches, radial and ulnar artery gives off recurrent branches. Branches of the brachial artery. Brachial artery gives off deep profunda artery, which surrounds the humerus and enters in posterior compartment of the arm, where the deep profunda artery is divided into middle collateral artery and radial collateral artery. Also, brachial artery gives off superior ulnar collateral artery and inferior ulnar collateral artery. Radial artery gives off radial recurrent branch. Ulnar artery gives off common interosseous artery, which is divided into anterior interosseous artery and posterior interosseous artery, and also ulnar artery gives off anterior and posterior ulnar recurrent branches. Recurrent branches passes upward, makes anastomosis to the collateral branches of the brachial artery. Radial recurrent branch anastomosis to the radial collateral artery from deep profunda artery. Posterior interosseous artery anastomosis to the middle collateral artery. Anterior interosseous descends on the forearm region. Anterior ulnar recurrent branch anastomosis to the inferior ulnar collateral artery, and posterior ulnar recurrent branch anastomosis to the superior ulnar collateral artery. So these anastomosis, which is formed between recurrent and collateral branches of the brachial artery, is formed at the level of the elbow, and this anastomosis must be known during the ligation of the brachial artery. So brachial artery must be ligated not above exist of the deep profunda artery. Why? Must be blocked the all blood supply of the upper limb, so that's why brachial artery must be ligated below the exist of the deep profunda artery. So where you want. below the exit of the deep profunda artery. So on the elbow, on the arm region, we have told that we have what? Four deep nerves, which are what? Ulnar nerve, median nerve, musculocutaneous nerve, and radial nerve. But on the elbow, we have only three deep nerves. Yeah, musculocutaneous nerve is not located deeply on the elbow because it continues into the lateral cutaneous nerve of the forearm. It is located in superficial layers, which innervates the skin of the lateral part of the elbow. So on the forearm region, from the elbow descends three deep nerves, and the arteries, which is located on the forearm, is radial artery and ulnar artery. Forearm region is bounded superiorly by the conditional line, which passes below the two transverse fingers placed on the epicondyles of the humerus. Inferiorly, it is bounded by the line which passes on the styloid process of the radius and ulnar bone. Superficial layers of the forearm region are skin subcutaneous fat tissue, superficial fascia. In superficial layers of the forearm lateral side, we have cephalic vein. Medial side, we have basilic vein. Lateral side cephalic vein is accompanied by lateral cutaneous nerve of the forearm, which is continuation of the musculocutaneous nerve, which provides innervation of the skin of lateral part of the forearm region. Medial side, we have basilic vein, which is accompanied by medial cutaneous nerve of the forearm, which comes from medial cord of the brachial plexus, so innervates the skin of the medial part of the forearm region. Between cephalica and basilica is on the forearm is also formed the anastomosis, which drains into the median cubital vein of the elbow. So on the anterior compartment of the elbow, on the anterior compartment of the forearm, between cephalica and basilica also is located the superficial veins. Below the superficial layer is located the deep fascia, which covers the muscles. On the forearm, also in anterior compartment, we have flexor compartment. In posterior compartment, we have extensor muscles. So anteriorly we have flexor muscles, posteriorly we have extensor muscle. All the vessels and the nerves of the forearm region is located in anterior compartment of the forearm. Flexor muscles, below the deep fascia, flexor muscles are located into four layers. First layer of the muscles includes brachioradialis muscle, pronator teres muscle, flexor carpi radialis muscle, palmaris longus muscle, and flexor carpi ulnaris muscle. So from laterally to the medial side, first layer of the flexor muscle includes brachioradialis muscle, pronator teres muscle, flexor carpi radialis muscle, palmaris longus muscle, and flexor carpi ulnaris muscle. Second layer of the muscles includes only one muscle, flexor digitorum superficialis muscle. Flexor digitorum superficialis muscle. Third layer of the muscle includes flexor digitorum profundus muscle and flexor pollicis longus muscle. And fourth layer of the muscle includes only one muscle, which is present in the lower third part of the forearm region, which is pronator quadratus muscle. Pronator quadratus muscle. By these muscles is formed the sulcuses. Also on the forearm we have sulcuses, which is formed by the muscles. We have three sulcuses: radial sulcus, ulnar sulcus, and median sulcus, which is present in the lower third part of the forearm region. Now on this picture, lateral side is shown brachioradialis, which is cutted. It descends to the lateral side of the forearm region. Radial sulcus, look, superior third part of the forearm radial sulcus is formed laterally by brachioradialis muscle and medially by pronator teres muscle. But lower third part of the forearm region, lateral side, it is formed by brachioradialis muscle, and the medial side, it is formed by flexor carpi radialis muscle. So in upper part of the forearm, radial sulcus is formed by brachioradialis muscle and pronator teres muscle, but lower third part of the forearm, it is formed by brachioradialis muscle, but medially the sulcus is formed by flexor carpi radialis muscle. Medial side, we have ulnar sulcus. Which is formed by flexor digitorum superficialis muscle laterally, and flexor carpi ulnaris muscle will be medial side. Lower third part of the forearm region, we have median sulcus, which is formed by flexor digitorum superficialis muscle, flexor digitorum profundus muscle, and flexor carpi radialis muscle. Radial sulcus includes radial artery and superficial branch of the radial nerve. We have told that on the elbow in anterior lateral cubital sulcus, radial nerve is divided into two branches, superficial branch and deep branches. Superficial branch so descends on the anterior compartment of the forearm. Deep branch enters in the posterior compartment of the forearm. So in the radial sulcus, we have superficial branch of the radial nerve accompanied with radial artery. Ulnar sulcus includes the ulnar nerve and ulnar artery. In median sulcus, we have the median nerve, also anterior interosseous artery, branch of the common interosseous artery from the ulnar artery. In the lower third part of the forearm region, between third and fourth layer of the muscles, so between which muscle? Flexor digitorum profundus, flexor pollicis longus, and behind pronator quadratus muscle is located Pirogov's fat connective tissue space. Pirogov's fat connective tissue space, where may be accumulated 0.25 liter of pus. In this space, if pus spreads into this space, it by fat connective tissue spaces may be spread in upper regions of the upper limb. Pus inflammatory process how can be spreaded in the pyrogos-fat connective tissue space? It may be spreaded when there is injury of the fingers, but which fingers? Fingers, synovial sheaths, fingers, tendons are located into the synovial sheath. First and the fifth finger synovial sheath is communicated to the pyrogos-fat connective tissue space. Second, third, and fourth finger synovial sheath is limited from palmar surface of the synovial sheath. Palmar surface of the synovial sheath is also communicated to the pyrogos-fat connective tissue space. This means what? That if there is injury of the first and fifth finger, inflammatory process from first and fifth finger may be spreaded to the pyrogos-fat connective tissue space. If we have injury of second, third, and fourth finger, it can't be spreaded upward because synovial sheath of these fingers is limited from palmar surface of the head. And if we have inflammatory process in the palmar surface of the hand, it also may be spreaded to the pyrogos-fat connective tissue space. So this means what? That injury of first and fifth finger is most dangerous than other fingers. Why? Because inflammatory process from these fingers may be spreaded upward to the pyrogos-fat space, and if it is not drained from this space by fat connective tissue spaces, it may be spreaded in upper parts of the upper limb. And during this case, what is done? Incision, if pus accumulates into the pyrogos-fat connective tissue space, incision is done medially and laterally above styloid processes of the radius and ulna. Longitudinal incision is done, and all that layers, what we have told, is dissected. Median nerve, as it lies superficially here in the lower part of the forearm region, is retracted not to damage this nerve, and is accessed the pyrogos-fat space, which is bounded so anteriorly by flexor digitorum profunda and flexor pollicis longus muscle, and behind by pronator quadratus muscle, and from this space is drained the pus. Do we understand? Are you here?
Yes, Professor.
Have we any question?
Questions, Professor?
So if we don't have questions, so all these portions at classes, student, you must prepare. Next week we start lower limb.
Yes, Professor. Understood.
Okay, thank you. Goodbye.